What is cough? Reasons, signs, treatment, and what are the precautions of cough? A cough is a reflex action to clear the airways of mucus, irritants, or foreign particles. Coughing can be acute, lasting less than 3 weeks, subacute, 3 to 8 weeks, or chronic, lasting more than 8 weeks. Coughs are also classified as productive, with mucus, or non-productive, dry. 1. Causes of cough. Infections, common cold and flu. Viral infections are a frequent cause of acute cough. Bronchitis, inflammation of the bronchi, often due to a virus or bacteria. Pneumonia, a lung infection that can cause a severe, productive cough. Tuberculosis, TB, a bacterial infection causing a persistent cough, sometimes with blood. Allergies and asthma, allergic rhinitis, hay fever. Allergens like pollen can trigger a dry, tickling cough. Asthma, often accompanied by wheezing, especially at night or early morning. Chronic lung conditions, chronic obstructive pulmonary disease, COPD, a progressive disease causing long-term cough and breathlessness. Lung cancer, chronic cough that may not respond to typical treatments. Gastroesophageal reflux disease, GERD, acid reflux can irritate the throat, leading to a dry, chronic cough. Environmental irritants, smoke, dust, and pollution. Exposure to irritants can lead to coughing. Strong odors or chemicals, fumes from cleaning products or perfumes may irritate airways. Medications, some drugs, like ACE inhibitors for high blood pressure, can cause a dry cough as a side effect. 2. Signs and symptoms of cough. Cough characteristics, dry or non-productive cough, no mucus, often caused by irritants, allergies, or viral infections. Productive or wet cough, produces mucus or phlegm, usually due to infections. Associated symptoms, sore throat, often accompanies a cough from infections or irritation. Wheezing or shortness of breath, common with asthma or COPD. Fever and fatigue, can indicate a viral or bacterial infection. Runny or stuffy nose, common with colds and respiratory infections. Duration and timing, coughs due to infections are often worse at night. Asthma-related coughs can worsen with exercise or cold air. Chronic coughs lasting over 8 weeks could indicate an underlying condition. 3. Treatment of cough. Treatment depends on the cause and type of cough. Medications, cough suppressants, for dry, irritating coughs that disrupt sleep, e.g. dextromethorphan. Expectorants, help thin mucus, making it easier to cough up, e.g. guaifenesin. Antibiotics, only if a bacterial infection is diagnosed, as antibiotics are ineffective for viral infections. Antihistamines and decongestants, help relieve coughs caused by postnasal drip or allergies. Inhalers and bronchodilators, for asthma or COPD-related coughs to open up airways. Home remedies, honey, a natural cough suppressant, especially useful for children over 1 year and adults. Warm fluids, such as herbal teas and broths, to soothe the throat and keep it hydrated. Steam inhalation, helps clear congestion and soothe irritated airways. Saltwater gargle, reduces throat irritation and inflammation. Lifestyle adjustments, quit smoking, reduces chronic cough and lung irritation. Avoid irritants, reduce exposure to allergens, smoke, and pollutants. Humidify the air, using a humidifier can prevent the air from becoming too dry, especially in winter. 4. Precautions against cough. Practice good hygiene, wash hands frequently to prevent the spread of infections. Cover mouth and nose when coughing to avoid infecting others. Avoid irritants, minimize exposure to smoke, pollution, and strong chemicals. Strengthen immunity, get enough sleep, eat a balanced diet, and manage stress to support the immune system. Consider the flu vaccine, especially during flu season, to reduce the risk of viral infections. Stay hydrated. Drinking plenty of fluids can help thin mucus and soothe the throat. Manage allergies and asthma. Use prescribed medications and avoid allergens to prevent allergic and asthma-related coughs. Keep the air moist. Using a humidifier in dry climates or during winter can help prevent throat irritation. By addressing underlying causes and taking these preventive measures, coughs can often be managed effectively and prevented from recurring.
Thank you for watching. Please like, subscribe and share our channel, The Amused Notebook.